entire Africa, we have only 3.6 million health workers that are serving 1.4 billion population of Africa. This is unacceptable. So we have agreed that countries must invest in training, employing, recruitment, and retaining health workers in the continent. I'm Dr. Okwari Joseph from Uganda, work with Ministry of Health Uganda. I work as the Director Health Services in charge of health governance and health regulation. We've had a number of these sessions on different themes, but this particular theme has been specifically on the role of the private sector on the new public health order. And today we had a very nice discussion on health workforce in the continent. As we know, health workforce is the engine of health service delivery, and that was agreed upon in the session. We also agreed upon the fact that health workforce in the continent is still inadequate. In the entire Africa, we have only 3.6 million health workers that are serving 1.4 billion population of Africa. This is unacceptable. So we have agreed that countries must invest in training, employing, recruitment, and retaining health workers in the continent. Many of the health workers and very good workers that we are training are leaving the country, and this is something that countries have committed to put a stop to. We need health workers to stay in the continent and provide health care to the 1.4 billion population of Africa. This is the only way we shall realize the dream of advancing universal health coverage and sustainable development goals for our people. This is a very good opportunity for narrowing the gap between the private sector and the public sector. We need to work together. There's a lot that the private sector can do which will enable the public sector to do better. In the area of technology, area of IT, in the area of innovations, we need the efforts of the public sector to be able to push us to other levels. The problems that we have today cannot be created by the same level of thinking that created them. And in the public sector, we have a lot of bureaucracies that sometimes stop us from achieving our goals. But working with the private sector along, we should be able to achieve the best health care for our people.